change. Still with us in the studio, Ian Cruikshanks. He's an independent financial analyst. And now joining us for a look at the healthcare sector as an investment space is Walter Adeo, who is lead director at Monitor Deloitte. Well, Walter, let's start with you joining the discussion, and let's just look at a big picture here. One would think that Africa is ready for investment, for investors in private healthcare particularly. My image is that of a largely state-run health sector in Africa, obviously variations from region to region and country to country.
I think you're absolutely right. I mean, there's definitely an appetite to look at Africa from an investment perspective, and it is mostly run from a state perspective. I mean, if you look at the stats Africa-wide, there's a massive out-of-pocket portion where consumers are looking for private healthcare services. And as we know, unfortunately, state services aren't as efficient as they should be. And you can basically see that from the spend against GDP. You know, in South Africa, we're looking at 8.3% against GDP. The rest of Africa is 5% and lower. And if you look at developing markets, or developed markets for that matter, like the US, you're looking at a GDP spend of 17.3% expected to grow to 20%. So it's quite clear that there's massive unmet needs in Africa. If you look at that further, I mean, from a population perspective, you have 11% of the world's population in Southern Africa with 25% disease burden in terms of world disease burden. So I think it does make it attractive from an investment perspective.
I suppose it varies from country to country, but thinking of the South African model where you've got a big state sector and then you've got 3 or 4 very powerful well-run, influential private hospital groups. Yes. You've got a pharmaceutical sector which has 3 or 4 big companies, and you've got medical aids dominated by one, but there are lots of them. So is that model replicated anywhere else in Africa?
No, look, the complexity and sophistication of our private healthcare market is definitely not replicated anywhere else in Africa. I think there's a need for it. As I mentioned earlier, I mean, this unmet need for private healthcare been driven predominantly by the growth of the middle market in Africa is there. And I think that drives a need for pharmaceutical services, for pharmaceutical products, private healthcare, and possibly insurance products.
Yeah.
Yes, you know, it just says, mentioning that US size of healthcare to GDP, emphasizes the huge potential that there must be, apart from South Africa's participation versus the rest of Africa. And South African companies have experience in all sorts of management skills in Africa.
Correct.
It must be a huge opportunity, and to prove that we've been able to do it without the government leaning on the private sector's shoulders is just says there's opportunity and it must be exploited, and I'm sure will be.
Correct. I mean, I think a lot of international companies looking for that continued growth are looking at developing markets. You know, they've looked to the east, to China, and they're looking at Africa as well, where Africa, you know, the growth in the pharmaceutical market in Africa is second to China at a CAGR rate of 10%, 10.6%, I think, through to 2016. So there is definitely a focus on Africa for growth. South African companies are well run. They're good springboards into Africa. They're good assets. So they are attractive. And we've seen the activity around CIPLA and Adcock over the last couple of days. Similarly, the South African organizations that have established themselves and grown in the African market are looking for continued growth and are looking at other developing markets, you know, Eastern Europe, Asia and India, etc. So it's quite an interesting platform, yes.
Mentioning CIPLA and Adcock, do you anticipate that there are other companies, international companies, who may have connections in South Africa who are going to say, let's consolidate that and use that as a stronger base for moving through Africa?
I do get the sense that that's the case. I get a lot of interest from the European markets and as well as North American markets with a lot of curiosity around Africa. Specifically, and using South Africa as a springboard into Africa. Yes.
How is it going to play out? Is Netcare, just for example, going to become the ShopRite of the healthcare sector in Africa? There must be different kinds of vested interests, different kinds of regulatory issues than for retailers. How complex is that regulatory burden?
Look, there's 2 components to it. One is, you know, there's multiple sectors to the healthcare market. You've got the funders, providers, and pharmaceutical companies. What's good for one is not necessarily good for the other. So practically speaking, you know, the unmet needs of the African population drives demand for pharmaceutical product. that in turn places burden on insurance companies that have to fund that product, or governments that have to fund that product. So that creates an economic tension between the two. From a regulatory perspective, that is a challenge in Africa. From simple matters like producing and manufacturing product on the continent. To move product from one region or one geography to another geography requires a product to be re-registered. So that does restrict access to product. It does make it expensive and does take time to get product to market.
Well, we'll pause now for a moment. We're going to be joined by Jonathan Brumberg, who is CEO of Discovery Health. For now, let's take a quick look at how those healthcare stocks are performing. Well, joining us now is Jonathan Brumberg, who's CEO of Discovery Health. Coming to you, Jonathan. Welcome to the panel. We were talking a moment ago about opportunities in Africa, and I asked if Netcare, for example, could become the ShopRite, or Discovery for the ShopRite of healthcare in Africa. You must be looking at expanding into Africa.
We certainly are, and we have been doing for quite some time. I think healthcare is different to quite a few other industries. We think of it as a very local industry. So the healthcare market in each country has many unique properties, and you can't simply export a model as I think you can in retailing or in other, say, fast-moving consumer goods. The other issue is to decide in a careful way when those markets are ready. Our judgment up until now has been that none of those opportunities are yet ripe for the picking. We like to not necessarily be first, but to enter at the right time.
Looking at we were talking about the triangle of pharmaceuticals, medical aids, and hospital groups. Now, in a sense, you can't have one without the other two. It's no use hospital group going in, but there are no medical aids. And so the other way around as well. No one's going to buy a medical aid if there's nothing to get with it.
Absolutely, and I think our judgment up until now is the supply side. The hospitals and the health professional side of those markets are simply not mature enough for formal health insurance. And you're right, there is a chicken and an egg problem. And I think it's hard to see how to break that logjam. Historically, the supply side tends to have developed first. And you do see it emerging in many of those countries. Nigeria, Kenya would be some examples. They're not yet, though, fully organized. So, for example, doctors, the billing procedures, the coding are still all relatively unsophisticated. That makes it hard for a health insurer to do business, particularly when we're used to highly sophisticated, scale environments.
Walter, what will break that logjam there? Which will put the egg or the chicken there first?
Well, I reckon the growth of the middle class in Africa will definitely drive that demand for sophisticated healthcare products, without a doubt. And then I think the pervasiveness of new technologies, mobile technologies, electronic payment, mobile banking, all that does facilitate getting the distribution of insurance products or health insurance products to the market, and also assisting doctors and healthcare providers to claim from insurance companies. It's definitely not an overnight event. I agree with that. There's a sequence of events that have to happen in a coordinated way to get it to the point. I do believe that the first step will be the pharma companies increasing their presence on the continent, increasing access to drugs, working closer with governments. On the back of that, the development of a middle class, and then the adoption of sophisticated, or maybe not that sophisticated, technologies to make the adoption and use of insurance products far easier.
Ian?
I quite agree with what's being said. And it just says it's not just Medicare where the opportunity is. Just listening to the settlement, you know, mobile telephony, what a big part it can play.
And we realise how sophisticated our system, interlocking system, has become. Jonathan, from a discovery point of view, you are a big player, obviously, in the medical aid area. Government is looking at the sector, competition issues. I was saying with some of the numbers that come out of the hospital groups, for example, or Discovery, that may say, no, these profits are too high. We need more competition. But you've got to work with government here. And where are you with that? Because in a way, this is the laboratory for the rest of the continent.
Yeah, I think it is. Look, we work very closely with government at all levels, you know, in the provinces and at national level. I think we're trying wherever we can to support the public sector improvement that is the major focus of the National Health Insurance initiatives at the moment.
And how are they going? How's the NHI in the pilot stage?
So it's in these pilots. You know, there's not a huge amount of information in the public domain about how they're going. Our general impression is pretty good, certainly in some provinces, a little slower in others. I think the important thing is all the right issues are being tackled. So key issues like management skills, logistics, infrastructure, nursing, supply and quality. So I think at least the diagnosis is right and the solutions are right. I think time will tell how successful the actual rollout is, but we're quite optimistic at this point in time.
On the one hand, Volta, it's management of things, on the other hand, it's the skills. And our pilot scheme can indicate what could be done more broadly if the skills are there. One gets the impression that there are enough skills for a pilot scheme and not more.
I think that's a general concern worldwide when it comes to healthcare matters, is the supply side of skills. The discussion is often, bringing in professional staff or nurses from the Indian market, for example. But if you take a look at their demand for healthcare professionals, it's similar to South Africa, and then we've got very good healthcare professionals that are in turn taken by other developing markets, and it's attractive to them from a salary perspective, income perspective. So that is a challenge. I think it's not just for South Africa, I think worldwide. The ability to retain professional skills in the market is definitely
Jonathan,
focus.
final question. What's the Competition Commission going to say? Are they going to find bad competition?
I think it's soon to tell. We're right at the beginning. I think that the way this is being set up is actually quite positive. It's not necessary for them to have to find lack of competition or collusion for this inquiry to ultimately be very positive. And the reason is quite straightforward. The structure of our healthcare system privately is not optimal for maximum efficiency and quality. We have the fee-for-service payment system, which does create inefficiency. We do have a lack of supply of doctors and certain types of hospitals. We have restrictions on the ability of hospitals to employ doctors. So I guess in a nutshell, we think that what this commission will do are two big things. One is create a solid evidence base for a good policy debate. Secondly, recommend some real changes that could have a material impact on cost and quality without necessarily finding any evil behavior. The one does not necessarily have to go with the other.